we continue to follow Wednesday's MTA bus crash in Pikesville. Police say the driver hit a dozen cars before slamming into a FedEx building on Reisterstown Road. 3 dozen people were injured. The bus driver suffered a broken neck, and tonight the University of Maryland Medical Center confirms all but one of the patients transported to their hospital after the crash have now been released.
And people at the scene told us how terrifying this experience was. Today, I reached out to a mental health expert to learn more about the impact of this type of trauma and when it's time to get help. A fast-moving MTA bus slams into cars in Pikesville, bringing down utility poles and sending dozens to the hospital.
It's traumatizing, big time.
Passengers coming out. The driver was trapped. Horrific scene.
Licensed counselor Adam Miller of the University of Maryland Upper Chesapeake Health's Klein Family Center in Bel Air says being involved in or even witnessing a crash like this one can have a tremendous impact on mental health.
Things like this can really kind of re-trigger you and bring up other really difficult emotions and memories.
Miller stresses the importance of recognizing the warning signs and knowing when to seek help.
If you start to notice a few weeks later, maybe 2 to 3 weeks later, persistent nightmares, inability to sleep, flashbacks while you're sleeping, noticing that your work obligations and personal obligations are starting to be impacted, it's starting to be hard to focus and maintain your routine, or you're starting to isolate, those types of things would be signs that it's important to maybe talk to a professional.
Miller also says people who have witnessed or been involved in traumatic events like that bus crash should avoid making major changes to their schedule. Another recommendation is to take a break from social media and resist the urge to turn to alcohol or substances to feel better. He also says that journaling can help you process your pain.
Good words of advice there.